Poisoning in children is one of the emergency pediatrics. So usually with poisoning they are brought to the emergency room. So today I'll be talking on kerosene poisoning. This is one of the commonest poisoning that is seen in children age group. Kerosene is one of the hydrocarbon and the toxicity depends on volatility and viscosity. Higher the volatility and lower the viscosity, there is more risk of aspiration. And less than 1 ml aspiration can produce significant serious life-threatening toxicity. That is chemical pneumonitis leading to acute respiratory failure and even death. So now come to classification of hydrocarbon. There are two broad groups. One is aliphatic hydrocarbon and another is aromatic hydrocarbon. So aliphatic hydrocarbon has a high volatility and low viscosity, and these compounds are less stable and more reactive than the aromatic hydrocarbon. There is a greatest risk of pulmonary aspiration with the aliphatic hydrocarbons, which leads to life-threatening chemical pneumonitis, even leading to death if the intervention is not taken properly or in time. And it is seen that aliphatic hydrocarbon, it has less systemic toxicity. That means absorption through the stomach is of less concern. So usually aliphatic hydrocarbon poisoning, we do not do gastric lavage or emesis because there is a high chance of aspiration when you do these things. So since the systemic toxicity is less, so it is better you let the hydrocarbon get absorbed, especially the kerosene, turpentine, spirit, lubricating oil, lamp oil, tar, gasoline. These belong to this group. So if a child comes with these poisonings, do not do gastric lavage. Maximum poisoning we do gastric lavage, that is the first step of management, but in this poisoning that is contraindicated. Now come to aromatic hydrocarbon. This hydrocarbon contains benzene rings and are more stable. It is also volatile, but it is less likely to cause chemical pneumonitis. So that life-threatening chemical pneumonitis or aspiration is occurring much less, in a less amount. But it is more toxic when it is absorbed in bloodstream. That is, if it is in the stomach, it is getting absorbed in the bloodstream, leading to CNS, liver, cardiac manifestations. So when large amount of aromatic hydrocarbon is ingested, and if the child is brought within less than 1 hour, you can do gastric lavage in these conditions, but with very special care. You have to secure the airway first. If needed, put a ET tube, then only do the gastric lavage in an aromatic hydrocarbon. That is also if there is too much or large amount of ingestion. Small amount of ingestion, you leave it like that. So benzene, toluene, xylene are coming under this group. But today we are going to discuss kerosene, which belongs to the aliphatic hydrocarbon group. So kerosene, this is common accidental poisoning occurring in the developing countries. The main reason being kerosene is used extensively as a fuel for cooking and lighting purposes, so very easily available. And number two, it is stored in a soft drink bottles or some water bottles, so children and other people, they get mistaken and then they drink this. So kerosene, the fatal dose of kerosene is 15 to 50 ml, and then if you aspirate, less than 1 ml will be sufficient to cause life-threatening conditions, and fatal period is 24 hours. So the management should be very fast in time, within 24 hours, otherwise it is fatal. Now pathogenesis. kerosene, one is it gets aspirated during coughing, swallowing, vomiting, gagging, or during gastric lavage, and due to its low viscosity allows them to flow from hypopharynx to larynx. Sometimes even without these above conditions, it slowly flows from the hypopharynx to the larynx, and then aspiration pneumonitis can occur. Another is kerosene causes surfactant deficiency by inactivation of type 2 pneumocytes. So when there is surfactant deficiency, there is alveolar collapse. Now come to clinical features. The commonest age group for kerosene poisoning are the toddlers, 1 to 3 years. So 2 years is very important because this is the time where the child is requiring maximum attention. So if you miss the child, if you don't see the child properly at this time, they happen to drink this kerosene if it is put in the simple soft drink bottles. So the symptoms begin soon after or 10 hours of ingestion. The immediate clinical feature will be cough, vomiting on ingestion, and then within hours fever may start, and then which may persist for 10 days. The pulmonary symptoms, it starts 12 to 24 hours after the ingestion, and it may be mild or it may progress rapidly to acute ARDS, acute respiratory distress syndrome, which is life-threatening, which leads to respiratory failure and then requires a positive pressure ventilation. So timely, if it is not managed, then there might be death also. So chemical pneumonitis is presenting with cough, shortness of breath, cyanosis due to hypoxemia. Other symptoms, systemic symptoms are restlessness, somnolence, abdominal distension, transient mild CNS depression, and later may have convulsion, coma, or cyanosis. But these systemic symptoms are more commonly seen with the aromatic compounds than the aliphatic compounds. In the aliphatic compounds, though these symptoms are there, these symptoms may be minor, and the chemical pneumonitis is more severe. And kerosene poisoning may land up with complications like pneumothorax, subcutaneous emphysema, pleural effusion, and after first week pneumatoceles may develop, and then again secondary infections can occur after few days or maybe after 1 week. Now let's see the scoring given by Gupte et al. So this scoring is helpful to tell the prognosis to the parents and also to manage the kerosene poisoning cases. So in the symptoms, there are fever, severe malnutrition, respiratory distress, neurological symptoms to be seen. And if fever is positive, you get score 1, severe malnutrition 1, respiratory distress score is 2. If there is cyanosis, you get 4 score. Neurological symptoms are there, that is 2 score, and if there is convulsion, you get 4 score. So according to, if the score is less than 4, that means it can be managed generally. If it is 4 or more than 4, then immediately transfer to ICU. So refer the patient to places where the facility of ICU is there. And less than 7 or 7, it is said that likely to survive with a good intervention, good management. But if the score is 8 or more than 8, then high chance, high risk of death. Severe respiratory symptoms are there. You can do blood gas analysis and even complete blood count if you suspect infection, secondary infections. Now come to treatment. Treatment, remove the child from source. You remove the child to the open air, remove contaminated clothes, and observe the child for at least 6 to 24 hours even if the child is having no symptoms, because the symptoms comes later in the poisoning. And pulse oximetry monitoring is very important, and then immediately give oxygen if indicated. Many times you give early oxygen. So hypoxia is treated earlier. Intubation in case of poisoning is always decided earlier than the other cases because many of the poisons it causes respiratory depression. So mechanical ventilation if there is a severe hypoxia, respiratory distress or decreased level of consciousness. No gastric lavage should be done, no inducing vomiting as there is a high risk of aspiration. A very large amount of aromatic compound is ingested and if the child is brought in less than 1 hour, then you may consider gastric lavage with the protected airway. So by expert intubation, then you can start gastric lavage. NG suction can even performed but with a great care. Then activated charcoal is not used because it does not bind the hydrocarbons and also it may induce vomiting, and vomiting is contraindicated in case of kerosene poisoning. The hydrocarbon induced pneumonitis if you see, then immediately start the supportive treatment with oxygen and intermittent positive pressure ventilation. Mechanical ventilation if required. Routine antibiotic use is not recommended. If you suspect secondary infection, then only you give antibiotics. So if there is a reappearance of the fever on 3rd to 5th day after injection, then you suspect secondary infections. And corticosteroids, there is no role. So no antibiotic, no steroids, only supportive management with oxygen and then positive pressure ventilations are very important or goal of management in case of kerosene. Prognosis, it depends on volume of ingestion, the agent involved, adequacy of medical care. Most survive without complications. But malnourished children, they have a poor prognosis or poor outcome. And the people who are progressing to respiratory failure, the death rate can be 2 to 10%. Thank you. We'll come again with another topic.